Hi, this is Dr. Jim Anderson from Anderson Podiatry Center, here to talk to you about endoscopic surgery. You're watching this video because your surgeon has advised you that that would be the next step. In very high percentage of cases, we avoid surgery for plantar fasciitis, heel pain. But when it's appropriate, I want to reassure you the success rate is very high. And it's interesting to note when we see people once in a great while that have heel pain. They may have had it for a long time, they're out playing a sport, they'll actually rupture their heel. So that's basically what we're doing, is we're allowing the fascia to stretch. But Mother Nature kind of does it for you sometimes. But don't go out and expect that to happen, but it can happen. If that happens, we put people in a removable cast 3 to 4 weeks. They're walking in this device called a cam boot. Removable cast is what it is. And it just reattaches, but it's longer, it's more flexible, and it's not pulling from the heel. And that's basically the goal of the surgery. We're using small incisions, and I've been doing this since the early 90s, as one of the earlier doctors in the country to do this. And basically in our surgical center, we make a little incision on the inside of the heel, and then there will be one on the other side. And we're inserting a device that's about the size of a pencil, and it's like a tube, and inside that device is inserted another metal device that is a scope, and so we can see your fascia. And when we're doing the surgery, we're not cutting the fascia where it attaches all the way across the bottom of the heel, but rather just the inner half, because that's where most of the pulling and trauma occurs, is not on the outside of the heel, but rather on the inside, because that's where the arch is the highest, so more pulling occurs there. One thing, as in terms of a complication that you need to be aware of, probably the most common thing, isn't that the surgery doesn't work and get rid of your heel pain, but that you could get pain on the outer side of the foot. This is called cuboid bone, or cuboid syndrome. This bone right here is the cuboid bone. You've got two bones here, the long metatarsal bones and the heel, and the cuboid is in between. People oftentimes before surgery are favoring their heel so much in an attempt to relieve their heel pain, they'll roll their foot to the outside and they put a lot of weight through here. Sometimes what will happen, we do the surgery and they have such quick relief of their heel pain that they go, what's this? I've got pain over here now. I don't think I had that before. Well, they did in many cases, but they just didn't know it because this was so much worse. So we get rid of this and then you start paying attention to this. And believe me, as you start walking more normally, as you go through the recovery course, this will just kind of automatically go away because you're walking more normally. We have learned through many experiences with doing these surgeries, from myself and other doctors throughout the country, that we want to keep the incision through the fascia less than 50%. We don't want to cut all the way across, because if you totally cut the fascia all the way, the surgery in itself can create cuboid pain. So that's something we want you to be aware of. I always tell people if it happens and it's down the road, maybe it's a month out after surgery, you may have to go back in the cam boot for maybe 3 or 4 more weeks. So it usually is very resolvable, but I just want to make sure you understand that. The infection rate with these kinds of surgeries is extremely low, and it's a very highly successful procedure. And when it gets to the point that you're at to do this, I think most people are very excited with the results. So hopefully that's a bit of good information for you. And if you have other questions, please don't hesitate to contact us, either the nurses in our surgical center, the medical assistants, or the doctor that has recommended this treatment. So thank you for listening.